Hi there. Thank you for tuning in and for sending your questions. I'm Dr. Clelia Lima, nurse practitioner with a passion for wellness. Our topic today will give you some light on nurse practitioners. Are they real doctors? We'll talk about that. I will also give you an update on the Omicron variant and the latest on the oral treatment for COVID 19 and the new vaccine that is already on the way. So, the title is kind of intriguing. Are nurse practitioners real doctors? And as I said, I am a nurse practitioner. So, first, I'd like to clarify a few concepts so we kind of, get an idea where we're going with um, this topic today. So, what is a doctor? So, the title doctor is a designation for a person who has earned a doctoral degree. That includes numerous degrees for dozens of disciplines, as you may well know. In many countries, the title doctor is used to indicate regardless if they hold a doctoral degree level for their medical program, because some countries they don't have the medical degree as a doctor level, but they still are called doctors because that's a custom. So it's important for healthcare professionals with doctor degrees to identify themselves so patients are aware which academic degree is behind the title doctor. So for our discussion today, we'll address, more specifically for nurse practitioners, okay? So first, what is a nurse practitioner? So, nurse practitioner is a nurse with a graduate degree in advanced practice nursing. So, we are called, um, just for abbreviation, NPs. So, NPs, nurse practitioners. Okay. So, NPs have a master's or doctoral degree, which include advanced clinical training. They are called doctors if they have a doctoral degree. Their most common designation is in the US, because other countries also have nurse practitioners. In the US is APRN, Advanced Practice Registered Nurse. So academical and clinical courses prepares NPs for practice in primary care, acute care, long-term, in different settings. So NP are experts clinicians assessing, diagnosing, treating, and evaluating acute and chronic conditions such as diabetes, high blood pressure, infections, injuries, many conditions. So NPs prescribe medications and other treatments like physical therapy, occupational therapy, speech therapy, and they evaluate patients' response to, and adjust, the treatment plan. So it's not only making a treatment plan, but evaluating and adjusting, because sometimes you have to do that. So nurse practitioners also order and interpret diagnostic tests such as lab work, x-rays, CT scans, MRIs. They also perform biopsies, sutures, joint and trigger points injections. And NP provides wellness physicals, including assessment for the progression of any degenerative health condition, screening for high-risk diseases. So NP provides a broad spectrum of care, including education and counseling to patients and their families. And most of the time, we are focused on preventing disease, prevention, and lifestyle modification. So we help patients to achieve better quality of life. So nurse practitioners manage overall patients' care and focus on the person as a whole and their well-being. So additional residence and fellowship can expand an NP's scope of practice to several specialties, including psychiatric, mental health, and also emergency and critical care roles. And those nurse practitioners are trained to do some very invasive procedures. So they can insert chest tubes, central lines, do lumbar punctures, paracentesis, thoracentesis. So several things that nurse practitioners can be trained to expand the role of their care and to treat patients better. But naturally, nurse practitioners are not allowed to do fellowships for surgeries and complex procedures such as cardiac arterization and those, because it's just the way the medical field does not allow for any fellowship other than medical trained professionals. So that's one of the barriers. So, how nurse practitioner, how the profession is started? So, the nurse practitioner profession is quite a young profession, just about over 60 years. So, it started as a response to the shortage of primary care physicians. So Dr. Loretta Ford, a nurse, and Dr. Henry Silver, a physician, they developed the very first nurse practitioner program at the University of Colorado in the 1960s. And then other countries, seeing the successful model, they started developing the nurse practitioners programs too. So some of the countries that have the role of nurse practitioners are Canada, Finland, Australia, New Zealand, England, Scotland, Wales, Ireland, and Netherlands. So it's still a lot of countries to expand, but it's interesting to see some countries that are applying the role of nurse practitioners to the fullest. And then they have a question here: how do you become a nurse practitioner? So depends on which country you are trained. You have different ways, but in the US you have to be an RN with a bachelor's degree first. You cannot go to nurse practitioner school without being a nurse first. You have to have an RN degree and license to get into nurse practitioner school. And it's very competitive. Some of you know it's very hard to get into, a nursing program. Some people want to and they just can't because it's so hard. But most nurse practitioners, when they start their program, they have already practiced as a nurse for over 5 years. So they bring into the program a wealth of knowledge and experience at the bedside, treating patients and just, knowing how to deal with some diseases. So it's very valuable. After you do the nurse practitioner program, which includes the clinical hours, you can do residencies for other specialties. And also, to start practicing as a nurse practitioner, you have to do a national certification, which is a very comprehensive exam that you have to really know what you're doing to get the certification, a national certification. And after that, you get a state license. Both of those certification license you have to renew every 2 to 5 years. So the national certification usually is 5 years, and the state license every 2 years. And to do so, you have to complete a series of updates, courses. So we call the CMEs. Those courses are pretty much like you have to keep up with the new guidelines, new evidence-based practice, and just get yourself current in your practice. So you have to continue learning, right? So the different in legislation from each state, as you know, each state has their own limitations and expansion for roles of all professions actually. So most states they have nurse practitioners um, practicing for full prescription authority. Actually, all states and nurse practitioner can assess, diagnose, treat, including prescribe medication. Some states and nurse practitioners have to work under a collaboration agreement with a physician. In more than 20 states now, nurse practitioners can practice independently and have their own practice. Florida, and like I said, they have all different nuances and how, the role is expanded. So, for instance, in Florida, we have the autonomous practice, and I do have my autonomous practice as a nurse practitioner. To qualify for that certificate, for their license, actually you have to have at least 3,000 hours of clinical experience and some extra curriculum courses to prove that you are capable of practicing independently. And I have my own practice, as you know. I own Fuel Telehealth, and it's really amazing what we can do helping patients. And we practice really within all the guidelines, and patients can expect to have treatment at the same level as with a physician. So the highest standard of care and codes of practice is just like, we have to follow them. It's not like you have less requirement because you're a nurse practitioner. No, you hold to the same level of standard as a physician. So then came the question, what are the main differences between MD and NP training? So we're talking about MD, but as you know, other programs like DOs and such, they also practice as a clinician. But we're not going to get into all the differences now. So we're just comparing MDs and NPs, okay? So we do have different training. Our academics are different pathways. MD training is more focused on disease management, and NP training is more focused on the whole patient with emphasis in optimal health and disease prevention. So we have the same goal, but our thinking is a little different because the way we are trained, it's focusing, in different ways. Interesting enough, lately we have seen more physicians, more MDs uh, going towards this practice of the whole patient as a whole, coming more towards nurse practitioners training, actually, right? So patients gain with that because, being seen as a whole person is always an advantage. So to get a medical degree, MD, you complete 4 years of bachelor's degree in science and then another 4 years of graduate medical school. After that, you go through at least 3 years of residency. So after that, you need to pass a national certification board and obtain state license. Just, nurse practitioners have those two requirements too. And they also have to renew their license and certification every 2 to 7 years. And they continue, they have to complete continuing education credits. Actually, we have the same level of credits that we have to, the same courses that physicians take to renew their license are the same courses that we take in nurse practitioner. So it's the same level. Um, Interesting that other countries, they may go through a different training to get a medical degree. In some countries, they are not even doctor level, but they're called doctors because it's a practice, a common practice that medical doctors are called doctors, but some of them don't have a medical degree. I mean, doctoral degree. And some of them, they go back to school to get a master degree and a doctor degree. But it's not necessarily a doctor level in some countries. So MDs have more hours of class work and more hours of clinical practice than nurse practitioners. But there's a debate about how many of those hours are relevant to clinical practice. So when you start a nursing practitioner school, you're already a nurse with usually at least 5 years of experience. So you have seen a lot, right? And you have been exposed to medical care, for a long time. And when people start medical school, they do 4 years of general science. So they go without the experience that we go to nursing practice. So there is a difference in the academics, there's a difference in hours. They have more hours, more academic hours. But at the end, when the patients are treated, they are expected the same level of care. If you come to an office, or let's say a telehealth visit with a nurse practitioner or with a MD, the level of care is supposed to be the same. We are held to the same standard of care, and we are supposed to practice within evidence-based practice. So you don't have to fear that you're going to have anything different, because we follow the same guidelines. Interesting enough, that the study shows that a nurse practitioner has less litigation than physicians. I don't know. And it's considered very safe delivery of care. And many studies have showed that patients treated by nurse practitioners have better outcomes than treated by physicians. So patients, let's say with diabetes, they treated by a nurse practitioner better controlled their diabetes than treated by a physician. And interesting, patient satisfaction, also nurse practitioners have a higher score. But you know what? At the end of the day, we're not here to say who is better than who. It's just to establish that we are safe practitioners and we have high standards of care. And patients like nurse practitioners because we treat them maybe in a very more holistic way, and patients appreciate that. So as far as outcomes, we are comparable or even better. So there we go. Um, the last one here is an interesting one. Do MDs choose NPs for their own doctors? Because doctors need doctors too, because you're human beings, right? So I have my own doctor, and my own doctor is a nurse practitioner. She's been my primary care doctor for over 20 years, and she's one of the best nurse practitioners in town, and I trust her, with my life. So a medical doctor would have a nurse practitioner for their primary care or for their doctor? The answer is yes. And I have in my own practice several doctors that are my patients. And I feel very privileged and very honored that they trust me. So, why a medical doctor would go to a nurse practitioner for their care? Because they trust, because they know that the nurse practitioner can treat them well, and they are high standard, and they trust. So yes, the answer is we collaborate together, we respect each other, and personally, I don't see like a competition or just trying to be better than whoever. It's just like at the end of the day, we want to treat patients well. We want patients to have access to care, because the more people we have treating patients, the more opportunities patients have to have their visit, because sometimes you cannot get a visit for weeks or months. So well trained and well prepared practitioners are just gain for the patient. So we are here to work together. And the answer is, are nurse practitioners real doctors? If your nurse practitioner has a doctor degree like I do, yes, we are real. We are real doctors. If a nurse practitioner has a master's degree, She's not a doctor, she is a healthcare provider. And actually, doctors, nurse practitioner doctors, physicians, we are all healthcare providers. So that's a big umbrella that just put us all together. We are healthcare providers, and our main goal is to take care of patients and to make them feel better and to make them live better lives. So nobody knows everything. So this competition, whatever, like, who is better than what, we all need each other. So in clinical practice, healthcare providers have to maintain that humility, because we don't know everything. So patients sometimes are the main instrument to help us to make a good diagnosis, and listen to patients is very important. So we don't own the truth, we don't know it all, and being humble to keep learning, to keep progressing. And if you think about technology, the way technology is expanding so rapidly, we just have to keep learning, to be just open to know and to serve our patients better. So I'm here for you. If you have any questions, please send your questions. Just a little update on the pandemic. Omicron is really all over the world. Now is the main um, variant that is all over. Is Omicron. The BA1 is still prevalent, but BA2 is expanding more and more. But they are more contagious, but not as severe. So it's been good that in a way we have a hope that it's going to change from pandemic to endemic. And people that are vaccinated and had Omicron, they have good immunity. People that are not vaccinated and got contaminated with Omicron, they develop the natural immunity as well. So that's good news for everybody. We still have the Molnupiravir and Paxlovid for treatment of COVID. The new vaccine that it's already in for approval from FDA. The Novavax is an option for people that don't like to have the mRNA vaccine. This is and the traditional vaccine with the antigen. So options and good news ahead. So if you have any questions or any comments, I'll be happy to entertain them on the chat. If not, we will see you next Tuesday. And if you need any consultations, I'm here for you as well. Please like my videos and subscribe to my channel and share with your friends. And I see you next Tuesday for another hot topic. Be well and feel well. Love you.